So I'm a fan of Dr. Mike, and I wanted to react to one of his recent videos, my terrible experience as a patient. This caught my eye, and I wanted to react for all of you.
I'm about to tell you a story about an injury that I had that then got worse from a medical error, then got worse with the worst medical encounter I've ever heard of, let alone I've had. This is gonna be a dramatic story, but it's gonna end with a few tidbits that you must know to prevent this from happening to you. Let's get started. Beep-whoop.
We have now two doctors guiding you through a bad doctor experience, so should be interesting.
All starts off with me wanting to improve my wrist strength, my grip strength, because I wanted to have stronger wrists for boxing. And I said, you know what? Let me do dead hangs, where I would hold on and work these flexors in my arm. And instead, what ended up happening, because I went from 0 to 100, which is the worst mistake you could do with fitness, and I knew that and I still did it, I developed a
I tend to do the same thing when I actually start exercising again. I always go too hard into it. It's always best to like ease into the exercises and all of that, as we know, but I have that tendency too, where I just like jump into it and end up often hurting myself, and then I have to scale back, and and I have to be really careful with my hands since I need them for surgery. So there are many exercises that I don't do anymore, and many things that I want to do, such as play competitive basketball or go rock climbing, that I'm too nervous to do, honestly, because I don't want to injure my fingers. But good on Dr. Mike for training for boxing and actually going and fighting, and that's pretty incredible that he can do that.
Condylitis, which is known as golfer's elbow. When you overuse the tendons here to flex your wrist like this, it's called medial epicondylitis. If you overuse the extenders, like when you're playing tennis, that's called lateral epicondylitis. So I had the medial version of this, and I was like, no big deal, a little physical therapy.
And my best friend, who's actually a veterinarian, also had this medial epicondylitis and just had surgery, orthopedic surgery, to try to connect a torn ligament there. Still hasn't recovered. It's been like 3 months. Poor guy.
A little icing, maybe anti-inflammatories, and it will go away. I've treated this dozens of times. However, it became a major problem. The more that I would box, especially punching the heavy bag or the speed bag, I constantly noticed that the pain was increasing. So while doing physical therapy, while even having my match against iDubbbz, the pain never went away. But I knew once my fight ended and I would have some time to relax, that I would eventually go do either a steroid injection or perhaps try acupuncture. I'm very much evidence-based in medicine, and while the evidence for acupuncture isn't great, usually it's a low-risk tool that could potentially help in a lot of cases. In fact,
when I had my episode of Bell's palsy, I was pretty desperate to get my face working again as quickly as possible. So I did go and I did try acupuncture as well for the first time. And I don't know if it sped up my recovery course, but I don't think that it hurt. I did find that after about a week of doing it, I started to get some of my muscle activity back. So was it going to come back anyway, or did the acupuncture actually help? I think that's where it becomes difficult to run studies on acupuncture to really show that its true benefit, because a lot of things just happen anyway.
Torn labrum that I've had ever since I was like 15, 16 years old from working out improperly. I had 2 sessions of acupuncture on that completely went away, even though it bothered me for years. So I've had a good experience with acupuncture. Find someone reputable in the city, find out that they're good with sports, go to the session, very professional session. He explains that
It's interesting because even like Dr. Mike, who has, I'm sure, many connections throughout New York City to a lot of top providers for different specialties, like he's still essentially Googling, things, because it is hard to find the right practitioner for something. And it's great when you have like a word of mouth recommendation of someone who people trust, especially within the field. So I think like many people don't have those types of connections, and so you end up having to go online and do a search, and then you don't know necessarily what you're even looking for. Like, do you judge the person based on the reviews? Do you judge their number of years of experience? Do you go based off of like how their website looks, or if they seem friendly, or if they maybe have like a social media? But how do you pick the right person to see for any medical ailment? Not easy. Even being a physician myself or like Dr. Mike.
Seen this a lot in fighters because we're constantly trying to keep our wrists straight like this, which means that there's a lot of flexion, especially when you make contact against something heavy. He knew what he was talking about, but was not overly confident. Not like, oh, we're definitely gonna fix this. And I think that's something important to look out for when you're going for a first-time medical visit. Did the acupuncture treatment. I was sore, incredibly sore the first day, because he had a unique style of using the needles. Like he would twirl the needle or maybe even flicking the needle. Again, a technique that I've never seen before. After the soreness went away, the next day, my pain and symptoms that were there for 8 months prior went down like 80%. So it basically became unnoticeable unless I was doing something really strong. And I was like, wow, this is amazing. Again, from just one time, one session doing acupuncture, my pain is gone, but it doesn't end there. I had scheduled a second session at his recommendation. When the day of that second session came around, I actually had some second thoughts. It's already so much better. Should I even bother going again? And I'm getting all these needles. It's limited benefit now. But I'm like, you know what? I trust this person. Let me go. And I went, and it was a little bit more painful this time, a little bit more aggressive, I would say. I was so
Too much of a good thing can sometimes be a bad thing.
for multiple days. So I really didn't move around much after that session. And then I developed the weirdest set of symptoms that I've ever had in my musculoskeletal system. And it's because I developed true nerve pain. When the acupuncturist was doing the acupuncture, it seems like he either hit my nerve or created some sort of scar tissue around the nerve that whenever I reached for something away from my body and there was tension placed on the skin, this area of my arm lit up as if someone was holding a lighter. But then when I would press on the area, there would be no pain.
Nerves are weird and can give off all types of sensations. One of the most complex types of pain disorders that we see in the head and neck is trigeminal neuralgia. And it's very difficult to treat. It's hard to pinpoint. We know generally which nerve, the trigeminal nerve, cranial nerve 5, that it's involved with, but it becomes very difficult to treat, whether you're using, the acupuncture or different types of neuropathic pain medications. Some people just have this chronic feeling of like burning and like needles in their face. It's very, very disabling at times. So it seems like he was maybe feeling something similar, but closer to his forearm.
I had an injured muscle or bone or some kind of tissue here. I went to hang out with one of my friends and he pulled me by my arm and just gently pulled my skin back. I fell on the floor with the most intense pain you can imagine. Went back to the acupuncturist because I sent him an email and he said that he could fix it. Didn't fix it, probably just aggravated it further, to be honest. I wait a week, I wait 2 weeks, not going away. And honestly, I boxed.
Sometimes what happens is you have a provider who delivers a service. The patient maybe doesn't do as well as the provider thought they would. And then you have sometimes another situation, a different scenario, a different problem that you have to treat. But that original provider isn't always equipped to then treat that new thing that occurred, that new problem that developed. And I think it's a testament to a good physician or a good practitioner when one can realize that the situation is sort of out of their comfort zone and they need to refer that patient onto the next provider to take the best care possible of the patient.
Honestly, I boxed through it. It doesn't hurt normally. It's only if I make a really exaggerated movement. And as I did that, I noticed that the nerve pain would get worse over time. And I was really getting concerned. Am I doing permanent damage to this nerve? So I said, you know what? I'm gonna find the top nerve specialist, pain management specialist in New York, because what my theory was, if that nerve created some sort of adhesion to the skin through scar tissue, maybe a hematoma, like a little bleeding that happened when you put the needles in, or maybe a neuroma formed, there's a procedure that you can do called the hydrodissection of the nerve, where you actually inject near the nerve under ultrasound guidance and put in liquid in there. It doesn't even have to be super medicated liquid, and it opens up the nerve and frees it up from its adhesions. So I got this specialist, found the best one with the most 5-star reviews.
So again, he's going back to the internet. Maybe he did ask around in his network of other doctors that he knows throughout the city. But oftentimes I find that that's the best way to get to someone who you can really trust. But it seems like, Dr. Mike went back to the web and was searching and found someone with these, all these 5-star reviews. Now, reviews are interesting and a whole topic in and of themselves. But of course, reviews are important for anyone's practice, right? That's what people search for, that's what people look for. There are different ways to get reviews, some legitimate ways, some illegitimate ways, and different physicians, and not just doctors, but like for any type of like restaurants, everyone has different tactics for how they get the reviews. And there are people who sometimes will pay for fake reviews and pay to get reviews taken down. It's a whole other world. The other thing that some people experience is that competitors will go on their website or on their profiles and write these bad reviews, so that can lower someone's rating when in reality they're still a wonderful doctor.
Legitimate website, good medical background, made TV appearances that I watched a few years ago that I thought were really good. So I called, scheduled, made the appointment, cash only, by the way, which is a little ridiculous, but I was like, fine, I'll pay the consultation fee. Very expensive. It was ridiculous. It was like $600. I said, you know what? This is really important. It's my career, boxing. I need to figure this out. When I come in, the doctor does not look like his picture. He looks like something happened to him.
So the doctor doesn't look like his picture. That's interesting. So maybe it's just an old picture that never got updated. Maybe he's using someone else's picture, but that's less probable. Often what happens, I feel like, as people get older, they're not always updating their photos. So like when I had all my hair, that was when I had a photo shoot for my website. And so those were the pictures that people saw. And then after I was then like bald and missing my hair for like over a year, I'm like, I have to update the website. It's not very truthful because patients are going to come in and be like, oh, you don't look like that anymore. So we did that. I did another photo shoot and we have pictures that we put up on the site. So I do try to think about that and try to think about the perception of other people and how they might view me on the internet. And then when they see me, you want that transition from the web to real life to feel somewhat seamless. It shouldn't be so jarring for people because then they get concerned.
Happened to him with his health. In his picture, he looked very fit, just significantly younger. It looks like he's confined to his chair. He has some sort of very coarse tremor where his hand is consistently moving as he's talking. And at times he was even mumbling where I couldn't understand the speech that he...
I mean, it's sort of sad to hear. He may have been suffering from a real debilitating illness. That brings up a whole other topic of when is it time for a physician to stop practicing? After a certain age, if your hand is moving, if your concentration is off, if you don't have the stamina, it may not be best to continue to operate and all of that. I know that in some countries, especially for surgery, they have like an age cutoff. After age 65, you can't do any more surgery. That maybe isn't right either, but it is at least some attempt to safeguard the care of patients because that's ultimately what matters the most.
He was presenting to me and I said, okay, this is no reason to jump to conclusions here. Maybe something happened with his health, but he's still a great doctor. Look at these reviews. Let's have a conversation and find out. So I sit down, we start having what I thought to be a conversation, and I tell him that this happened about 2.5, 3 weeks ago. And from then, he just talks for like 30, 40 minutes about potential treatments before examining me, before asking any real questions about the details of what happened or what symptoms I'm experiencing. And already was recommending injections of an antidepressant into my arm. I know oral medications that are labeled as antidepressants can work for nerve pain, but to inject them is not something that is typically done. He also recommended PRP as an option. Doesn't have great evidence for a lot of the things that we currently use it for.
The evidence for hair loss is actually fairly good. It isn't as good for facial aesthetics. I'm not familiar with the literature when it comes to like joints and dentistry. PRP definitely is used for those types of applications too. At least for hair loss, we have a whole video on that. Make sure to check it out. And there is decent evidence that PRP does help with hair restoration, but PRP for what Dr. Mike was going in for, yeah, I'm sure he knows that literature better.
Asked, like after 40 minutes of talking, and very difficult to understand him, what my oral treatment options were, if any. And he basically said that I was gonna get fat if I took any of the oral options. So he kind of shut that down right away. He said, but I wanna do an ultrasound. I said, I'm fine to do an ultrasound, but watching him perform the ultrasound, he was unsteady. His tremor was preventing him from getting a clear image. There was like reads being done of the ultrasound that I understood, that I thought were really high highly inaccurate or poorly explained to me as a patient. And the ultrasound was done in the wrong portion.
Sometimes also, like, I don't know if this doctor knew who Dr. Mike was. He may have had no idea. I mean, sometimes we assume that someone knows that we're a physician, but that's not always the case. And the flip side of it is that once you go to another physician as a physician, the treatment is definitely different. Oftentimes, the other physician will somehow just think that we understand their specialty really well, and that's not always the case. So it's always best, I think, when you're treating another doctor, to treat them as if you would just treat any other patient.
Wrong portion of my arm. He then changed the treatment plan completely. He didn't really ask where my symptoms were. He just started looking at my elbow. Another thing that stood out from the visit was he told me another patient's case, said the full name of the patient, said their age. These are all privacy matters that should
HIPAA.
never be discussed with another patient. You could say, I have another patient in your age group or whatever, but you can't say their full name. And at that point, I was like, I need to get out of here because this is weird. This doctor didn't do a history, didn't do a physical exam, recommended 2 treatments, changed it to a 3rd treatment.
It sounds like that other doctor that he went to just has like his spiel that he gives to every patient that comes through the door, no matter really what you're coming in for. He has his list of options of, I could treat you with this, this, and this, and that's pretty much it. He's not really there to listen. The best types of doctors in any type of specialty are those who really understand the concept of like empathy and like hearing your patients out, and that requires time, and it requires sometimes to talk less from the physician side.
Treatment. This is all for cash. The doctor does not look like the picture. Like, I didn't know what was going on, and now I understand why people don't speak up in stressful situations, because I genuinely didn't know what was happening. I thought it was like an episode of Punk'd. That's how bad it was.
Well, yeah, you're entering into someone else's clinic. You almost feel like you're now like in their house, and you don't want to be disrespectful, and you don't want to say or do the wrong thing. And so there is that level of discomfort with that. But you have to speak up for yourself. And I think for any patient, that's super important.
It was probably my worst patient encounter I've ever seen. It was scary because I could see how if you don't have a medical understanding of what he was saying, there could be some situations where you're like, oh, well, this person's a doctor, they have a license, I'm gonna let them do their thing and inject whatever they say. But man, how scary is that? He could have, if I would have let him, injected me with antidepressants for huge sums of money.
Yeah, there's some people who come to me and they've had these injections into, let's say, their lips or other parts of their face, and I ask them, like, what were you injected with? And oftentimes they have no idea. And that's super scary to me, that someone would do something without explaining it and just go for it, and the patient would just say, okay, sure, like, they're the professional, I'm sure they know what they're doing, and I'll just trust the process. My approach and my practice is to bring people into the decision making and really kind of make collective decisions that seem to make the most sense for them, but that they fully are immersed in and that they fully understand. And then, of course, there's the element of surgery that has some unpredictable parts to it. Same with any procedure, as he was saying, with like this hydrodissection. You don't know, is it going to work? Is it not going to work? Is it going to lead to more problems? And all those things are possibilities, but you have to at least enter into these procedures with like a full sense of understanding.
With no real explanation as to why it should work. The one thing that they told me, which I found ridiculous, was, oh, it's similar to vampire facials. And I just wanted to say, like, my symptoms have nothing to do with vampire facials. Everything that could go wrong breaking down in a medical visit went wrong here. And when we told them that after the visit, all they said was, oh.
So I'm glad that Dr. Mike and his team like gave that doctor some feedback, because it's good for them to know, and they maybe will never change their way, especially if he's older and he's been doing this in the same way for many, many years, which is crazy that, you know, he's probably treated so many people with this style of treatment, and somehow, you know, they haven't complained enough for him to not be in practice anymore or doing the same type of stuff. But I'm glad that they spoke up.
Need more information about what treatments we do? We said, no. What we're saying is we're worried about the well-being of your other patients, as well as we think we had a horrible visit because no exam was even performed. They said, sorry you feel that way. Here's your money back. Hope you heal up quickly. Like, what? Upon leaving, I realized I needed to reach out to some other people. Luckily, through social media, I found some great doctors who I'm thanking right here. that have helped me out with my arm. I ended up finding 2 case studies online of people who had nerve damage due to needles, and they had similar symptoms to me, and they did well with some oral medications, including prednisone. So I ended up using that for a period of a week. My symptoms got a lot better. They're continuing to get better, so I'm slowly recovering.
I feel like prednisone helps most conditions temporarily, and then it's not a great long-term solution. But we give prednisone, for example, like if I'm doing like a lip surgery and I know there's going to be a lot of swelling, I give prednisone preemptively. Also for hair transplants, we give prednisone. Sometimes other situations like sinus surgery, we used to give prednisone. Also in my core field, which is ear, nose, and throat, there are certain situations with the ear where people get sudden hearing loss, where we also give prednisone, which is a steroid. It's good for a short burst and short period of time to reduce inflammation, but not something you want to continue taking for a long period. And I know Dr. Mike knows that.
I'm not 100%, but my elbow pain went away. So
Good.
the acupuncture worked. How interesting is that?
You need him to box again.
Like, the acupuncture gave me this negative outcome, but it solved my initial problem. But all that really goes to show is a few key takeaways. One is you have the right over your body to accept or deny treatment. So if any doctor or medical professional is making you feel uncomfortable, do not be afraid to say no and advocate for yourself. You don't need to get any procedure. Or if you don't understand a procedure, stop it. Don't get it done. You need to adequately be able to assess risks and benefits. The recommendation from your doctor for the treatment might be correct. I'm not saying they're wrong. All I'm saying is if you aren't comfortable, something's wrong in that situation that needs to be corrected before the procedure is done. Next, when you're going to get some sort of alternative treatment like acupuncture, know that is not 100% safe.
This is what I tell people, because oftentimes, especially for hair loss medications, people ask me like, oh, are there any side effects? And I tell them anything that can potentially help you can also hurt you. That's always my line to people. And that includes medications and it includes surgery as well. Know the potential side effects and risks, and know that that list can be quite long, but that there are almost always a few main key, most common things that could occur, and know what they are, and you have to be willing to accept them prior to going through any type of treatment.
Frequently, I talk about acupuncture and say, you know, it's safer than the surgical option. So if you could avoid surgery, it's better. That does not mean it's 100% safe. Clearly, it helped my original problem, but then it created a new one that has been a real big pain. I think it's like the saying that Paul Offit said on this channel. He pointed out that anything that has evidence to work or is proven to work also has to have negative effect.
Yes, that's exactly what I just said. Perfect.
Because if it doesn't have negative effects, that means it likely doesn't do anything in the first place. As far as my arm goes, hopefully it'll continue to recover and I'll be back in the boxing ring before you know it.
Great, that was awesome. So thanks for Dr. Mike for sharing his story, and hopefully you liked some of the commentaries. About 1.5 years ago, I did a reaction to Dr. Mike's thoughts on plastic surgery. So make sure to check out that video here.